now that we know what egg freezing is, let's move to fertility treatments. I understand that there are multiple fertility treatments that are available today to any couple, and somehow IVF is like the on top. Like that's the one term that everybody knows. Like okay, और कुछ नहीं तो IVF है. So, like, just letting our viewers know, it's not like that. There are multiple treatments available before you can, opt for IVF, which are probably less painful, less invasive, and also with lesser medications. Like, I mean, while medicines are good to help you achieve a certain goal, if you can avoid them, then nothing like it, so I just wanted to like know what other options are available under the big umbrella of fertility treatments.
Yeah, so there are, like you said, there are multiple options. The simplest is, starting with just ovulation induction, follicular sonographies, tracking the ovulation, asking the couple to have timed intercourse. So you see, some couples are not aware of this fertile window, so they may kind of skip it, or some women may not be ovulating when they feel they are. So they may skip that very short time when the egg is released from the ovary, which is just 24 hours. It stays in the pelvis, I mean in the body, for just 24 hours. So if that time 24 hours is missed, the entire month is gone
Gone.
practically. Because you're ovulating only once in that one cycle. So just ovulation induction and timed intercourse. Then after this would be something like an IUI, which is intrauterine insemination. So these are options, and it's not just this. Basically, it depends on what problems the couple has. Like, suppose the female has a fibroid inside the uterus, lying inside her cavity, or a polyp, then that needs to be removed. So a laparoscopy or a hysteroscopy treatment may need to be done even before IVF. So IVF is one of the options, and IVF may be the only option also. Like in a couple whose husband has a very, very low sperm count, that couple is not going to be not going to benefit from an IUI or a natural conception. So that couple is directly for an IVF. Similarly, if women like PCOS women who are not ovulating, so in PCOS there is an ovulation, or so they might just benefit from simple ovulation induction medicines and trying naturally, and they conceive. So they feel like, you know, uh, that was so simple, but it's
Simple.
so like you have to literally each treatment, each couple needs a sort of tailor-made approach. It's not that everyone is the same or each couple gets the same kind of treatment from a fertility doctor.
So when we speak of the lesser invasive fertility treatments, we you mentioned IUI. What is
Yeah.
IUI?
Yeah, so IUI is basically, like I said, it's intrauterine insemination. It is when so in a broader sense, what we do is the procedure per se is uh, insemination or just injection of the sperms, of
Okay.
healthy motile sperms, prepared sperms inside the female's uterus. So
Okay.
in IUI also what we do is we will give some medicines, oral medicines, which are again hormonal medicines or ovulation induction medicines, plus some injections to have 2 or 3 follicles grow. Like in IVF, we want multiple follicles to grow. Here we want 2 or 3, only 2 or 3. And we will monitor this by doing our follicular ultrasound scans. And when these follicles grow to a certain size, which is 18 to 20 millimeters, we give HCG injection for them to rupture. So we expect that these follicles that have grown will rupture inside the woman's body, and then 36 to 40 hours after that, we call the couple. We ask the husband to give his semen sample at our clinic. The sample is then processed, it is centrifuged, by centrifugation, we basically separate the good motile sperms from the dead ones. So we are not injecting the dead sperms and the bad sperms. We're only injecting the very, very motile good sperms by a very fine catheter, which goes inside the cervix, inside the uterus. It's like doing a pap smear or a round, transvaginal ultrasound. It's not at all painful. So uh, the semen is then injected inside the uterus. And then we do the pregnancy test 14 days later, just later to see if she has conceived or not.
Basically, what we're doing is we're helping the egg and the sperm meet at the right place at the right time.
Correct.
Remember, for IUI, the tubes of this patient, the woman have to be open. They have to be patent. If there's a tubal block, IUI is not going to work. So it's not like going to increase the chance of conception from, say, naturally, if she was to conceive, it was 10%. This would be like a little 10% more than that. But it's not going to be like a 70-80% chance of conception.
Correct. So IUI is an option available to couples who have maybe say a good decent male fertility but diminished female fertility.
So, mild male infertility, but
And
not very severe male infertility, and females who are maybe not ovulating, so PCOS patients, but who have open tubes, because the
got it.
fertilization is going to happen inside the female's body. So the tube has to be open for IUI to work.
And if the
We've
tubes are closed, then if the tubes are not open, then the only option is IVF.
Is IVF, yes, yes. So I gather that usually IVF is the last situation. Like then, like your last option is IVF for sure. When you have IVF makes literally like any IVF is possible for every couple, given that there is a motile sperm and then there is one egg and there's one embryo that is formed. So that is the thumb rule for IVF. But like, what about couples like you said who are unaware of their fertile window? How do you help them? Like, I've also read about things like a follicular study wherein like women come in, when everything is fine, they're just not able to conceive. Maybe the timing is off, the opportune moment is getting missed every month. So can you explain to us what follicle studies actually is? And do you
Yeah.
help
So
them with medication, or is it like completely uh, unmedicated, non-invasive, and it's like it's just a process of figuring out when
So basically, we can know when the woman is ovulating. The best way to know that is by doing a transvaginal scan, right? And how we normally do this is by calling the woman. Ideally, we would do this. We do a sonography first, maybe on the second day of her cycle, just to see if everything is okay. Then maybe we call her back. On say the seventh or eighth day of the cycle when the follicle would have grown. So normally in a menstrual cycle, one follicle grows, is selected, grows, and then goes on to ovulate, right? Which is what we are basically seeing on a follicular sonography. So we've called her on the eighth day, and we're seeing that this follicle is growing. Then we'll probably call her back on the 10th or the 11th day. This follicle size will grow more. And then when the follicle size is probably 18 or 20 mm, we will either, now this follicle, either it grows naturally or we can even, sorry, yeah, either this follicle grows naturally, or we could even give her some medicines, oral medicines for forming these follicles.
so fair enough. So then you tell them on the like when you see the
Yeah, so
follicle rupturing is when you tell them to go carry on, have sex, and eventually they may conceive through that cycle. So basically
yeah, so
when
when
you can see
basically,
the
yes.
follicle growing ready to welcome the semen inside, right? And the baby will eventually happen there. So okay. So I keep saying this in the most absurd terms because I'm not a doctor, and like I just noticed all of you were laughing about it because I mean this is how I talk, or like I explain this to a lot of people because I've heard so many women come to me and say, "Arey IVF hai." I'm like, listen, IVF is very like it's a very serious thing. You do it if you need to. There's 20 other things you can do before you do IVF, and I feel like nobody has even heard of these terms like IUI or a follicle study, or there's another, I think I was just reading somewhere, I saw it on Instagram, wherein you just take medication on the last few days when your follicle is going to rupture, and
Yeah.
or there was something about like putting some glue to like get the semen, and I was like, what is this? Like, is this for real? Or are these just like hoax things that you see on Instagram?
No,
Then there
so
are also, yeah,
So
you're
yeah,
saying.
basically follicle. So the follicle, suppose we do the scan on the 11th day and we see that the follicle is say 18 to 20 mm. That's when we know that it is ready to mature, ready to ovulate, right? So we can either give an injection, which is most commonly the HCG injection, to induce ovulation, or if the patient does not want the injection, we basically give the patient the option. It's always good to give the injection to induce rupture, because that we know that that's when we know that 36 to 40 hours after giving that injection we know that ovulation will happen, so we can time the basically we
Intercourse
can
or
time
the,
when they need to have intercourse
correct,
correctly. Yeah,
correct.
so that is what is basically a time. It's called ovulation induction with timed intercourse.
Got it. So in terms of all of these treatments, when all of this fails is when you move to IVF, or are there certain patients you know for a fact that, boss, this is an IVF situation, and like these, like you said, like a follicular study will work for a couple who have enough eggs also and good motile sperm also. Then IUI works for couples that have maybe decent motile sperm and they need help with the ovulation. But like when you have, like you said, you mentioned blocked tubes, that could be for various reasons, or there could be someone with absolutely no motile sperm and you'll get probably one, or you do a certain amount of treatment and then get the sperm to like liven up, or there are like, luckily for men, you can there are so many things that you can do to fix the fertility issues, whereas with women it's like egg hai या nahi hai. You cannot take anything to increase the egg production. So, like when you say like it comes to IVF, um, what are your like baseline, like, so these problems are like to be tackled by IVF only. So do not waste your money, your time on other things, because time is very essential in fertility treatments. uh that's my ultimate disclaimer. First question is your age, and like are you ready like to have your child now? Then you need to start working towards this goal now, like immediately from your next period. You need to like get at it, go to your doctor, see your things, do your like start eating clean, detox your body, whatever it is that you can do which does not require medication, and then the rest leave it up to the experts to handle your situation. So in terms of IVF, what cases would you say like are like bang on? You need to do IVF and start now. Like it's going to take you some time. Even IVF is not like this cycle you will conceive. Lucky people do, and like they're very lucky. Congratulations. But like in the fertility race, it's usually maybe one or maybe the second, sometimes more.
Yeah. So, like you said, one is block tubes, definitely IVF, unless the laparoscopy can help open them. But again, that's questionable. Secondly, very bad sperm count, very low sperm count. So something like less than 5 million, this is not going to improve drastically, even if you stop smoking, and even if you lose weight, you cure your diabetes, you take n number of antioxidants, it will really not change much. Or men who are azoospermic. So there are men who don't have any sperms, zero
Oh,
sperms.
Okay.
Yeah, so these men will obviously will need IVF, not IVF, but actually ICSI, which is, like intracytoplasmic sperm injection, which is a way of IVF in men who have very, very low sperm count or no sperm. So in these men, we have to retrieve the sperms via surgically, basically, through the testes, via microtisa or through the epididymis. Basically, they need surgical retrieval of sperms because their semen does not have any sperms. And so such couples will need an IVF directly. I would say women who have a low ovarian reserve, who are above the age of 35, 36, instead of sort of doing multiple IUI treatments, they would definitely benefit more from an IVF because the time to conception is reduced in an IVF vis-a-vis a IUI, and you're anyway spending a lot on IUI as well. I mean, it's not as much as IVF, but you are spending an X amount on IUI, and when you do multiple cycles, it comes up to the same thing. So might as well, do IVF and sort of improve your chances of
Chances.
conception.
Okay. So in some,
Endometriosis, one more thing which is not
oh
kind
yeah,
of known or spoken about. Endometriosis is something which really affects female fertility. It reduces the egg quality. It reduces it. The anatomy is disturbed, so the sperm and egg cannot meet, and conception is delayed, etc. So even in severe endometriosis cases, IVF really works.
is a
Also for
requirement.
couples
Okay.
that have a known genetic problem, like, for example, thalassemia. Um, if that needs to be checked before we transfer an embryo, IVF is what can be offered to them along with pre-implantation genetic testing. So the embryo can actually be biopsied, the genetic analysis of the embryo can be done, and only the normal embryo is what is transferred. So this also is helpful for,
Yeah.
women. Yes, absolutely. So you can avoid, transferring genetically abnormal embryos, and only the normal embryos will be transferred. Say, for example, a couple, thalassemia is actually very common in these. So say a couple, both the husband and wife have thal minor. There is a chance
Of the child being
of the
thal
child being
major.
major. So that is an absolute indication of IVF and, selecting the right normal embryo to be transferred. That is one. It's also helpful for women who are older, and we know that older women, have a higher risk of aneuploidies. When I say aneuploidies, the commonest example is Down syndrome,
Correct.
right? As a woman's age advances, the possibility of her having a genetically abnormal baby, an aneuploid baby, commonest being Downs, is increases. So this is something that can be checked before, and through IVF, only the normal embryos can be selected and transferred. That's also another indication for IVF. And of course, if egg freezing has been already done, then IVF is going to be needed to put the
Transfer the
embryo,
embryo in. Correct.
transfer the
Okay. So
embryos.
now coming back to our IVF topic, after we do egg freezing, what is the next line for IVF? Now, we spoke about egg freezing for women who would want to delay, getting pregnant. So you probably do your egg freezing in your younger years, and there is no such thing as old, but yeah, like in your late 20s or in your early 30s, I think up to 35 is also still a decent time to have some realization and freeze your eggs, because you do assume that things will work out by the time you're 30, 35. You figure out if you're going to have a partner or not, and maybe if
I
you have
think it's
not
never
found.
too late. I think
Yeah,
it's
it's
never too late. We had someone who was 38 who came to us for egg freezing, and we got 12 eggs for her.
Yeah. So
So
like you
it's
say, you
never too
finish.
late.
Correct. So you finish your egg freezing, and then if you know who you're having your baby with, and you found your partner, in terms in India it is your husband. We don't have to like partner around it. And if you want to conceive single, as a single parent, I guess you need a sperm donor.
Yes.
So as long as you know where the sperm is coming from, how do you continue with IVF? What is the next process?
Yeah. So the eggs are basically thawed and they are injected with the sperms. Either it is, the donor sperms or the sperms of the husband. And these embryos are then, we then check if the eggs have fertilized. So we can check on the 24 hours after the procedure was done. And these eggs are then transferred back either on the third day or the fifth day. So these embryos are basically grown until the third or the fifth day. And then obviously we will not transfer back all of the embryos. We will want to only transfer one or two or maximum three to improve the chances of conceiving. The rest will have to be refrozen, basically. And it have to be a procedure via IVF. The embryos, the uterus of the woman will have to be prepared for uh, you know for the transfer, and the formed embryo will then be transferred.
So when you do IVF and if you've not frozen your eggs, so essentially you start on your period, you come to the doctor on the second day or the first day of your period, and you start taking your hormone injections and prepare your body for the egg retrieval. After which your egg retrieval is done under a procedure of general anesthesia. The eggs are taken aside and they're all injected with the semen and all of that. And then say 5 days later you come back to the doctor and you put the embryos inside. Now, is there a reason you differentiate between the 3 and the 5 day embryos? What is the difference?
So if we have less number of eggs, we will not want to wait until the fifth day, because there is a chance that we might lose those embryos, we would rather transfer the existing number of embryos rather than risk the possibility of losing the embryos, as in if the embryos don't grow up to the fifth day. But ideally, we would want to wait until the fifth day, because the good quality embryos usually always grow until the fifth day, which is the blastocyst, right? And if we have good number of eggs, if we have good number of embryos, then we would want to wait until the fifth day to transfer the embryos back.
Got it. So when you say you have lesser eggs or the lesser embryos and you don't want to lose them, my very like a layman's question, in at least I would have, like I'm just curious to know. But if it won't last till the fifth day outside, how will it last inside the womb? Or does it change how does that work?
No, sometimes there is still a possibility that an embryo which may not grow until day 5 uh, outside in a petri dish may implant in the womb, because obviously it's not the exact same environment, right? Finally, it is in vitro, it is outside the body. So but I mean, usually embryos that would have implanted, or rather do implant, would have probably grown until day 5.
Yeah, right? Okay. So that was
Yes.
my
I think,
question.
yeah, it's a good question, but I think it also depends on the fertility clinic that you're going to. So every clinic has their own sort of,
Protocol.
strategy protocols that they follow. So some do only day 3 transfers, some do blastocyst transfer. If you see the overall success, there isn't much difference between a day 3 and a day 5 embryo transfer in terms of pregnancy rates, like live birth rates.
Got
So
it.
that's what all the data and all the research has shown. So, but yes, we do believe that blastocysts are typically better than day 3. So now we have also moved to like preferably all blastocyst transfer.
So there was, a few years back, I was on these multiple WhatsApp groups with, like women trying to conceive. It's called those TTC groups, or then there are multiple IVF support groups, and somehow most of them used to talk about sequential transfers being like that was, like the sure shot success with sequential transfers. And uh, I just want to understand sometimes, like I feel like, do you think it's luck? At the end of the day, it's science plus luck, 50-50
It
in
is
There is
conceiving.
definitely
a part
luck.
that is,
It is definitely luck, but it is also quality of the embryo. I think the
Embryo, yeah.
embryo quality and uh, the uterus being normal.
Correct.
Those two things are embryo quality, which depends on egg quality and sperm quality, and also the uterus being normal. That's what it is going to boil down to.
So when you say uterus being normal, I guess you're mentioning the uterus lining being ready
Endometrium.
to take the embryo
Lining
in,
being
right?
ready, and also the uterus being normal, as in, sometimes women have conditions like fibroids or even adenomyosis, or even not always can these conditions be corrected prior to doing the IVF. Like adenomyosis cannot be corrected via, like a diffuse adenomyosis is difficult to be corrected by surgery before doing an IVF. And that basically definitely reduces the chances of a successful IVF. Even something like endometriosis,
Correct.
even if it is corrected, the disease still exists. So these are multiple things which can affect the success rates.
Got
And
it.
what you were saying, endometrium. So some women have very thin endometrium, or their endometrium may have been damaged because of a prior surgery or a prior miscarriage or a
What is
DNC.
the endometrium is the lining, is what you're talking about? Okay,
Lining,
got it.
the triple layer
The
that
uterus lining.
basically
Yeah,
to the embryo transfer, it is what we are looking at. The endometrium should be above 7 or 8 millimeters. It should look good. It should have good blood flow. So these are all good factors. If it doesn't have good blood flow, if it is very thin, it's persistently thin, it's less than 5 millimeters always, definitely it reduces the chances of implantation. So
so
these are, yeah, people are
so
kind of working
Tubercular
on.
infection also, a previous
Yeah.
tubercular infection can
correct,
impact lining, can impact the endometrium. It may just not grow. So
correct.
this reduces the possibility of an implantation.
So now coming to like we say, first you prepare your body for the embryo. So now, like in unfortunately in IVF, the male contribution is just semen, and then they can just take a back seat and support their wife emotionally and just be there for her or your partner. But in terms of preparing your ovary to have, like you said, good blood flow, to have good lining, other than like having maintaining a healthy diet, eating what you do, doing things naturally, some women like who are regular with their workouts can be doing that. I've also read and heard that acupuncture helps increase your blood flow and things like that. Do you all recommend, like, I sometimes feel it is all psychological, but I'm sure that acupuncture also has, because a lot of fertility groups, along with your doctor, they always recommend that, please seek, acupuncture or acupressure therapy before your embryo transfer, because I know for a fact that it reduces your anxiety, and anyone who's doing fertility treatment has skyrocketing anxiety. So do you also think that acupuncture does help a little bit to get like the blood flow gushing?
So I think there is absolutely no downside to it. It can definitely be tried. And like you rightly said, I think the the mechanism of how it works is it reduces your stress levels. And stress levels are going to uh, grossly impact the success rates. So that's probably how it helps. Yes, it may also improve the blood flow, but we are not really there is no way of improving the blood flow to the uterus by doing acupuncture, right? So I think more scientific reason why it helps is probably by reducing the stress
Reducing your
levels.
anxiety.
Yes,
Okay, and
yeah, exactly.
also in terms of when you're in the follicular phase where you're getting your eggs out, do you recommend anything outside of the medication that women do in terms of like their lifestyle, or how do you prepare your body to get good eggs? Do you do this
Yeah.
before your cycle starts, or do you do it while the cycle is going on?
So actually, you don't really have to do anything out of the ordinary, but yes, definitely not smoke or drink. That is a given.
For how
Exercise
long?
definitely.
For how long? Is this before the cycle
Well,
starts, like 3 months before
yeah,
you
I
just
think
detox?
when you have decided, it's best the earlier you stop it, the better it is. like a glass of wine maybe is okay occasionally. Don't quote me on this. I'm not advising this, but jokes apart, I think it's best avoided.
Yeah.
But yeah, no smoking, drinking definitely helps. Eating healthy, sleeping well, sleeping on time. Again, all of this, is managing your stress well. Exercising also definitely helps. Of course, you will not be able to exercise once you start the treatment. Light walks are okay, but something strenuous is definitely not advised. And also I think having certain supplements which have a combination of multivitamins and antioxidants, this is what in my opinion definitely helps the quality of eggs and even the sperms that can be uh, retrieved, because there are so many environmental things that impact the quality of our eggs
Your
and
eggs.
sperm. So having these antioxidants basically reduces the the oxidative damage that it does to the gametes. So
So
taking those
it's
is
funny.
definitely
It's
helpful.
funny you say antioxidants because most like the first time when I was considering joining these fertility groups, this one the icon or the what do you say the display picture of the group was a pomegranate. And
Yes,
it used to irritate me, and even to till date whenever I look at a pomegranate I'm like cannot eat one more anardana in my life, like that ain't happening. But yeah,
yes,
antioxidants, so berries and pomegranate,
absolutely.
they
Yes,
are your best
absolutely.
friends while
Yes,
you're trying to conceive via fertility treatments. Also, is there something
yes.
called a mini IVF, or is this a joke?
No, there is something called as a mini IVF. So basically, mini IVF is something like basically it is mild stimulation IVF, right?
Oh,
So yeah, minimal stimulation. Where you use lower dose of the hormonal injections that you normally use. So in conventional IVF protocols, you use something like a 150 to 300 IU of whatever hormones you're being injected with. In mini IVF for the mild stimulation, you use less than 150 international units. And you can also use oral medicines like clomiphene or letrozole, so in conjunction with that. Uh, where it actually helps is in older women, like
hmm.
women who are like 38 and 9 or above 40, who have a low ovarian reserve, like their AMH may be less than 0.5, where you're not expecting to get like 8 or 10 oocytes. Maybe you might be expecting to get only 4 or 5 oocytes. So when you give a higher dose, this is the science behind it. It's not followed by everyone, and it's not something that is proven beyond doubt. But what is said is that when you give lower dose of hormones, it reduces the cost of the whole treatment, because you're anyway going to get only 3 or 4 oocytes from that woman. So why give such a high dose of injection when you can do with the same, when you can do with a lower dose and get the same results? And it may to some extent also improve the quality of the eggs that we retrieve from that person, from that one side. So yes, there
Got
is
it.
something like IVF. It is being practiced for poor responders. So it works basically in poor responders, older women, women over 40, where, like I said, they have a very low chance anyway. So the cost, the complications, all of that is sort of reduced.
It might also help younger women with blocked tubes, where we know the quality of eggs is going to be good, so we don't need to give them such a high dose of medication. So giving them a lower dose of medication, we get good number of eggs. We don't want too many eggs retrieved, because we will achieve a positive result with uh, a normal number of eggs. So which is why we can give them a lesser dosage of injections. And since they're also younger, the quality of the eggs are also expected to be good.
So, sometimes when we stimulate PCOS women for IUI cycles with small dose of injections, just 75 or 100 units, uh, we aim to get 2 or 3 follicles. But what if more number of follicles develop. Like what if 10 or 15 are developing, then what do you do? So the only option is either to cancel the cycle, because you can't get like so many multiple eggs being released, because the chances of higher order pregnancies above 20
Multiples. Yeah,
will
multiples.
increase, right? So either you cancel that cycle, or what we can do is convert it
A
into an IVF.
retrieval. Yes, yes.
So that
Yes.
can also be done. So with that lower dose, we are giving that benefit of the lower dose also to the patient. She doesn't lose out on that cycle. We get
Cycle,
good
yeah. Eggs.
number of,
Yeah,
so cost is also not much to the patient.
that's true. So now coming to our next topic, which is surrogacy, which I also want to tell people that this is an option. I don't understand the legalities because a lot has changed in terms of law with regards to surrogacy in terms of gestational carriers, wherein the genetic embryo is your own and the carrier is the womb is like in the most common terms, it is just a you're putting your embryo in another womb. That's a gestational carrier. There are multiple different combinations to surrogacy, which again, like with IVF, you have sometimes there's an egg donor, sometimes there's a semen donor. So it could be from the same person who's going to carry your embryo, or it could be from a completely different person and put into another womb. But in terms of surrogacy, um, how high is the success rate where obviously the couple would have tried IVF on them multiple times before like considering this as an option. Also, surrogacy is now banned for people who already have children. Like this is an option legally available only for people who do not have any genetic children, whether this is your first or second marriage. If you have a child, you're not eligible for surrogacy. So in terms of like how does it change, like why does the embryo not implant into the womb of the person who gave the egg, whereas it would maybe implant into a gestational carrier? Like what are these parameters that change drastically to get a success with a surrogate transfer?
So, you know, most commonly the reason for surrogacy is the uterus not being okay for multiple reasons, right? Maybe the uterus has multiple fibroids, or maybe it has adenomyosis. Maybe for whatever reason, say it is even a normal uterus, but there have been multiple IVF failures, implantation failures, right? That could also be a reason for surrogacy, an indication rather for surrogacy. Or, the lining of the uterus just not growing, or like the uterus, it's a condition called as Asherman's, where there are adhesions inside the cavity of the uterus, which could be because of previous miscarriages, or multiple. So for a miscarriage or for like an MTP, often a DNC is what is performed, right? Like a dilatation and curettage, where the products are evacuated out and the uterus is curated. So, multiple procedures of this in the past can damage the cavity of the uterus, making it impossible for it to bear a child in the future. It's called Asherman syndrome. Or sometimes there could be a woman born without a uterus. And in fact, we've had a couple who've, basically, the female was born without a uterus, without a vagina as well. And we surgically created a vagina. These women who don't have a uterus have their own ovaries. So we retrieved out her eggs, and we used her eggs and her husband's sperms, and we transferred it in a surrogate. Luckily, we did this before the Surrogacy Act happened. Yes, and she conceived. The surrogate conceived. So this couple has a genetically normal baby, despite her not having her own
A
uterus.
uterus, yeah. So, like I say, science has improved so much, but like, how does it improve your chances? Like now you said this is in a very rare case, but in regular
Yes.
cases also, surrogate transfers are almost always successful. Isn't that true?
That's not true,
Oh, is
Priyanka,
it?
because it will finally depend on the quality of the embryo also. Like I said, finally it boils down to the uterus, the lining of the uterus, and the quality of the embryo. And of course, to an extent, the age also of, the couple, and also, yeah,
Got it.
age of mainly the woman.
Yeah. Like I said, the contribution of men in IVF is just a
So the
10-minute job.
egg is VIP. Egg, there is just
Yeah.
one egg which is released. It's VIP, and there are multiple, like there are millions of sperms which are
Sperms.
released.
Yeah. Correct.
Yeah,
Correct. So yeah, so I feel grateful that y'all have had this conversation with me, and just for our viewers to know that y'all are doctors practicing in India, in Bombay, in multiple clinics across Bombay, and y'all have been practicing for over 10 years, both of y'all. Yeah. Yeah, and it's this is a trusted source, you guys, and the reason why we have y'all on board is because no matter how much someone like me would like to explain fertility treatment, because I mean it intrigues me that you can do so much with science. Like you said, you can even reduce the risk of, like, for example, when you do the test at your 17th or 18th week to find out if there's Down syndrome. I mean, why the heartache if you can test the embryo and put it in? Like
absolutely,
it it's not just about, like, it saves you so much heartache. uh,
absolutely. In fact,
in
since you mentioned in the US, PGT is always done before IVF.
Correct, correct.
Yeah, it's
But
mandatory.
like it also, like, I always tell people that when all else fails, we can go to science ke department se jayenge, and I truly feel I feel absolutely happy to know that, like, I keep seeing your both of y'all have Instagram handles that are so crisp in terms of giving away information that is so vital, because many people think IVF is a happy pill which you can just have, but not many people know that you need to do this entire round of egg freezing or egg pooling, and then you do the IVF and you put it back in. A lot of people also think, I really don't want to get pregnant or get fat, so I will just have them by a surrogacy. It doesn't work like that. You need to do IVF, or you need to, find an egg and find a semen, or find someone who's willing to part with an embryo. And there's multiple parameters. Then there are people who have two and three children, and maybe, like, they have all of the same gender. And, like, no, I want to do IVF to have a boy. I'm like, you cannot trust the gender of the child in India. So there's these multiple, like, slaps giving, that I like to call them, like, myths that are, like, you can bust. Of course, like, abroad you can test the gender of the embryo and then put it in, but that's also because abroad you can find out the gender of your child while you're pregnant. In India, it's absolutely illegal, so you cannot even imagine doing such things. Secondly, I feel like women who have it easy, in term when I say easy, nothing is easy, but, like, at least if your body is normal and everything is going fine, do not mess with your body. If you know you want to have children, just get on with it. I feel like the sooner you do it, the better it is. Also, while raising your children, you have the energy to run behind them. But for people who are aware of the fact that you need certain financial stability, so you can't immediately get at it, seek all options that are available. Dr. Amrita and Dr. Aditi are always open to conversation. You can please, book your appointment and slot your, self in their schedule. They would probably guide you better than anybody can. And I always feel, do not rely on Google. Google says a lot of funny things, like, you can sleep with your legs on top, you can do yoga and all of that. And if it was that easy, many people would not seek help. But if you need help, and honestly, 10 on 10 women know it in their gut when they need help. So do not disregard your gut. Go to your doctor. And if you are looking for someone to help you with fertility treatments, here are two young women who are, ready to help you out and have state of the art technology to, access whatever you need. And it's all in one place, so you don't have to run to multiple locations. So yeah, thank you so much for your time, and I really hope this helps many women out there. And if anyone needs anything, you can reach out to me, and I would be happy to connect you to Dr. Aditi and Dr. Amrita. And by the way, they're sisters, and their mom is also a gynac, and they have a full blown hospital and everything under the sun. So you don't, like I said, you don't have to run around multiple places. It's a everything all in one inclusive situation. So it's very convenient if you're working, and if your schedule is busy and all of that. This is one place you can reach out to. Thank you so much for joining me. It's been an absolute pleasure, and I love talking about this because baby making is not just going on a vacation or relaxing. For some people it's a little more than that. And when you have doctors who can listen to you and guide you according to what your lifestyle is, or guide you according to your personality trait also, I feel like it's nice to come to a young doctor who can understand what is going on, as opposed to sometimes when you go to older doctors, you half the time you're worried that they're going to judge you, or you feel like, oh god, am I overstepping your like my limits, or like sometimes, like I would easily ask you, doc, can I have one glass of wine? Surely I would have asked that question. But I would never ask this to a very senior, like, old person. She'll be like, dude, you want a baby or not? I'm sure that would be our response, because like most moms would all say that. But I guess like with like in today's day, it's easier, like, when you're communicating with someone who is your age, you can, seek immediate advice and without hesitation. And I feel like that's something that you look out for when you're looking out for a doctor. You need to be able to speak like transparently without hiding any information, because your doctor won't judge you, and it's your job to give your doctor 100% truth, and not be like, oh, I never smoke or I never drink. And like, maybe your doctor won't say no, but they can see everything, like it's kind of obvious eventually. So thank you for being there on Instagram, spreading information. Thank you for being here on my podcast. It's been an absolute pleasure talking to both of you.
Thank you. Thank you so much.
Thank you for having us. It was really nice having this conversation. I think we also enjoyed as much as you did, and I hope the viewers also get all the take home messages.
Yeah, I hope this is helpful for the
Yeah, and all the best for your the little by little podcast. I really love the
Thank
whole
you.
idea, and I wish you all the best for it. I'm sure it's going to do very, very well.
Thank you so much. Thank you.
Thank you for having us, Priyanka. We had a lovely time and it was a very interesting discussion. Best wishes to your podcast, and let's do this soon.
Yes, yes. Thank you. Thank you so much. Bye.